Thanks again for joining us. I will give you, first of all, the usual update on the COVID statistics. An additional 51 positive cases were confirmed yesterday, which is 0.6% of people newly tested yesterday, and the total number of cases now is 20,107. There'll be a full health board breakdown released as usual later, but I'll give you the provisional information right now, and that is that 10 of these 51 new cases are in Tayside, where of course we're dealing with the Two Sisters food processing plant cluster. 14 are in Greater Glasgow and Clyde, 3 in Lanarkshire and 2 in Grampian. The remaining 22 cases are spread across 6 other health boards. I can also tell you that 255 patients are currently in hospital with COVID, which is 2 fewer than yesterday, and 3 people today are in intensive care, which is 1 more than yesterday. In the past 24 hours, thankfully, no deaths were registered of patients who had tested positive over the previous 28 days, and the number of deaths under that measurement is still 2,494. My condolences again go to everybody who has suffered loss, because these figures every day are a reminder of the impact the virus has had. I'm joined today by our National Clinical Director, Jason Leitch, and also by the Chief Constable, who is going to say a few words after me, amongst other things about the new regulations on indoor gatherings that come into force today. Before then, though, there's just a couple of issues I want to cover briefly. Firstly, let me just highlight and underline an announcement that was made by the Scottish Government last night. We have taken the decision to add 2 additional countries to the list of countries that are subject to quarantine restrictions, and these countries are the Czech Republic and Jamaica. So from tomorrow, if you're travelling to Scotland from these places, and that includes people returning to Scotland from these places, you must self-isolate for 14 days on your return. Cuba, though, was removed from the international quarantine list, so anyone arriving in Scotland from Cuba from tomorrow no longer has to self-isolate. But let me be clear that if you have arrived from Cuba in the past few days, you still must complete your 14 days isolation. These changes are yet again a reminder of the fact that the list of countries that require quarantine can change quickly in response to changing levels and prevalence of the virus. So please do think carefully before deciding to travel overseas at the moment. Even if there is no quarantine requirement for a country when you leave Scotland, that could very easily change by the time you're due to come home. So my advice remains to think very carefully about non-essential foreign travel right at this time. Secondly, I'll give a very quick update on some of the main clusters that we're currently dealing with. As of yesterday, there were 177 positive cases in the Cooper Angus cluster associated with the Two Sisters plant. 157 of those were workers at the factory and 20 were contacts of those workers. That's an increase of 11 in the past 24 hours. All of the additional 11 cases were members of the workforce. And at this stage, it remains the assessment that there has been no wider community transmission, which remains obviously very encouraging. All workers at the factory and their households should continue to self-isolate until Monday. Next, the situation at Kings Park School in Dundee. There are now 36 cases identified as part of that cluster, which is an increase of 2 since yesterday. Of these 36 cases, 22 are staff members, 11 are contacts and 3 are pupils at the school. But yet again, here there is no evidence at this stage of wider community transmission. In relation to the outbreak in Aberdeen, there are still 263 cases associated with the pub cluster, and the total number of cases in Grampian over the past month is now 447, which is an increase of 10 since yesterday. But it remains the view that the outbreak in Grampian is under control. Finally, I mentioned yesterday a small cluster in Hawick. A further 4 confirmed cases were notified to Test and Protect yesterday, which brings the total number of cases in that cluster to 11. All contacts are being followed up and self-isolation and testing has been recommended where that is appropriate. There will be a mobile testing unit at the Teviotdale Leisure Centre car park in Hoyk between 3 o'clock and 5 o'clock today through until Wednesday. And the routes to that mobile testing centre are firstly if the local incident management team is contacting you and advising you to get tested, but secondly if you are booking a test because you have symptoms in that area, then that facility is available. These mobile testing units are really important to us in helping to ensure that tests can be more accessible across Scotland, particularly in areas outside the Central Belt. As a further element of our plans to expand testing, I confirmed earlier in the week that we would also be establishing walk-through testing centres in different parts of the country. I can confirm that the first of those centres will open later today in the Victory Memorial Hall in St Andrews. The site there is close to the centre of the town and it is easy to reach without a car. In addition, additional support is available for vulnerable groups and people with disabilities. However, you're still advised to book in advance if you are using the walk-in centre, and of course tests can be booked online through the NHS Inform website for that centre from today. We plan to establish 6 walk-through centres in total by the end of September. These will mainly be in areas with large student populations, which was of course a consideration for St Andrews. There'll be a further 5 opened over October, but in total we are planning to have 22 of these walk-through centres in place during the winter. So today's opening is a first stage, but it's an important first stage in developing walk-through centres and making testing more accessible for people in different parts of the country. Of course, it's already possible wherever you live to get tested in other ways. If you don't have a car, for example, you can request delivery of a home testing kit. And you can do that in the same way that you book other tests by going to nhsinform.scot or phoning 0800 028 2816. And let me just take the opportunity to stress again that if you have any of the COVID symptoms, but only if you have any of the COVID symptoms, you should book a test immediately. Don't wait to see if you start to feel better. And those symptoms are a new persistent cough, a fever, or a loss of or change in your sense of taste or smell. Other symptoms, particularly for children, like a runny nose, if they're not accompanied by one of the COVID symptoms, should not lead to a test being booked. The final issue I want to update on today relates to culture funding. I can confirm today a further £59 million package of support for the culture and heritage sectors. This support is part of the £97 million we received earlier in the summer as consequential funding from UK government announcements. Today's package includes funding for Historic Environment Scotland, additional help for freelancers, support for the development of new creative work and support for independent cinemas and for youth arts. One significant element is a £15 million culture organisations and venues recovery fund to safeguard key parts of our cultural infrastructure. And that fund will offer support to commercial theatres, galleries, comedy venues, orchestras, theatre and dance companies, larger music venues, nightclubs and production facilities and studios. Its aim is to protect jobs, offer increased opportunities for freelancers, remove the threat of insolvency and support a viable and sustainable future for organisations and venues. More information, including, crucially, information on how to apply for this support, will be made available next week by Creative Scotland. Our culture and heritage sectors, of course, are hugely important to our economy, but they're also really important to our well-being and our happiness as a country. They've been very hard hit by this pandemic and we are determined to do everything we reasonably can to support them. So we hope that today's package will provide some much needed assistance to cultural organisations, artists and other freelancers across the country. I'm about to hand over to the Chief Constable, but let me end, as I always do, by stressing the importance of our public health advice. This advice is important because if all of us deny this virus opportunities to spread, we will succeed in suppressing it and hopefully in eliminating it. As we go into the weekend, please think very carefully about indoor meetings in particular. When you are indoors, please don't meet up in groups of more than 8 people from a maximum of 3 different households and physically distance yourself from people in other households. And remember, that advice applies if you're in a pub or a restaurant, just as it does if you are in somebody's house. From today, police do have new powers to disperse larger gatherings inside homes of more than 15 people. These powers will allow police to stop events which are significantly in breach of the current guidelines and which therefore have the potential to transmit the virus between lots of people from different households. However, they are, as I said yesterday, a last resort, and I'm sure the vast majority will continue to stick to the rules. Finally, let me just end with a reminder of the Facts campaign and the 5 golden rules that it encapsulates. Face coverings should be worn in enclosed spaces. Avoid crowded places. Clean your hands and hard surfaces regularly. 2-metre distancing remains our advice, and self-isolate and book a test if you have symptoms. Thank you to everybody who is helping us in these different ways to continue to control the virus. I'll now hand over to the Chief Constable before he and I, and of course Jason, will take questions from the media as usual. Chief.
Thank you, First Minister. All of us naturally want life to become as normal as possible, as quickly as possible. That's entirely understandable. And of course, since the start of the pandemic, people in Scotland have been asked to take personal responsibility, to step forward and support what are indeed very restrictive measures on personal freedoms of movement and associations, measures which have never been seen before. Our experience thus far is that people have overwhelmingly demonstrated that personal responsibility, high levels of cooperation, and I thank every person in Scotland for that. I've repeatedly expressed my concern and compassion at this forum and elsewhere for our young people who have faced significant restrictions at such an important time in their lives and their developments, when many milestones are arising. Children and young people have a right to socialise with their friends, and it is the responsibility of all of us as adults, in my view, to support them to do this safely. So from the outset of this emergency, the advice has been clear. Indoor gatherings of people from multiple households can allow the virus to spread and should be avoided. The public health advice has been very clear. The First Minister has just underlined that, about the dangers of transmission from indoor house parties. So thus, as the First Minister announced yesterday, indoor gatherings of over 15 people are now against the law. It is vital that everyone sticks to the rules to do the right thing, to control the spread of the virus, to address the public health emergency and to protect life. In essence, don't arrange or attend large house parties. Please meet in smaller groups. And we have seen people very visibly changing their lives to do the right thing. For example, there have been extremely high levels of compliance for the requirement to wear face masks when one is shopping. Police officers and staff have been in communities across Scotland, day in, day out, 24 hours, 7 days a week, to provide guidance and advice as the rules change. And what we've found over the months is that the vast majority of people have stepped forward and are making the changes and sacrifices that's being asked of them. As the Chief Constable of Scotland, I thank everyone for their commitment and their forbearance. The regulations and rules have often changed quickly, but the approach of Police Scotland has not and will not. We will act with courtesy and common sense to maintain that relationship of confidence and trust we have with our fellow citizens. And that's been reflected, that relationship, in the remarkably high levels of interaction officers have had with the public throughout the period of the pandemic, the overwhelming majority of which have not resulted in any formal enforcement. We will always seek to engage and encourage our fellow citizens, but we will take decisive action to enforce the law when required. I'm hugely grateful for the support and cooperation policing has encountered, and it actually is encouraging to see early indications that public confidence, if anything, in policing has grown during this difficult period. That consent, that public confidence is crucial to our legitimacy as a service. And the confidence, trust and consent that does exist is based upon the critical work of officers and staff who have also been required to attend and respond to significant and critical needs beyond the pandemic. And across all of these requirements, in my view, officers and staff have continued to act with tact and common sense, and I thank them and their families for the commitment to public service and public well-being. Finally, supporting those at additional risk when at home or when in the online space remains a real significant concern for me and a priority for policing. We've said a number of times that home is sadly not a safe place for everyone, and I would again urge and encourage anyone with concerns for themselves, their families or their neighbours' safety to contact the police. We are here at all times to help and to keep everyone safe. Please, keep doing the right thing. Don't arrange or attend large house parties. Look after yourselves and look after your families. Thank you.
Many thanks, Chief Constable. And can I just take the opportunity to add my thanks to police officers and staff across the country for the very significant contribution that they have all made to helping us through this really difficult period. We'll move now straight to questions. First question today comes from Katrina Renton at BBC Scotland.
Thank you very much, First Minister. Now, first of all, I've got a question for the Chief Constable on the new police powers on house parties. We want to know if they're workable. The Scottish Police Federation spoke to GMS this morning and said their members have questions about the rushed legislation and say that they have found some loopholes. So we're wondering how that's going to be enforceable. And to yourself, First Minister, the UK government is preparing a push to get people back to work. Is this good news to get the economy moving again, or do you think it's a risk to public health?
I'll hand over to Chief Constable on the issue of the enforcement powers in a moment. On the UK Government's comments around return to office working, what I would say is, firstly, these will be decisions for the Scottish Government to take as part of our route map out of lockdown. Second point I would make is that we want to get back to normal as quickly as possible. I think there is an opportunity for all of us to decide what we want normal to look like in the future. Do we want it to look exactly the same as the pre-COVID era? And, I think flexibility in how people work and, allowing people to strike better work-life balances, we should perhaps think about grasping those opportunities. But generally, we want to get back to normal as quickly as possible. There have been discussions with the Economy Secretary and the Chambers of Commerce this week about how we, similar to the approach we took with construction, how we perhaps work in a phased way to supporting the safe return of those offices that are still not open as normal, but supporting workers working from home. But that has to be done in the context of continuing to suppress the virus. And our judgment so far has been, and remember I've said this very often in the past, we have to look at individual decisions, obviously, and try to get them right, but we have to be very mindful of the cumulative impact of everything we're doing. And the numbers involved, if we simply get back to everybody going to offices or call centres as normal, and the pressure on our public transport system when the physical distancing is important there, would create, in our view, right now, too high a risk of the virus spreading very quickly. And that would then compromise our route out of lockdown, perhaps take us backwards, and it would also significantly compromise, in our judgment, the ability to keep schools safely open. So we will continue to take a careful, but hopefully absolutely forward approach to this to get people back into the office where that is appropriate as quickly and as safely as possible. My final point would be this. I will not countenance in Scotland any kind of narrative around this that is seeking to almost intimidate people back to work before, as a country, we have taken the decision that that is safe. People should not be told, if you don't get back to work in an office right now, if you're still working from home, you might be at greater risk of being made redundant or sacked. I don't think that is the kind of approach that we want to take here. Individuals and indeed businesses should have the right to expect to look to government for advice about what is safe to do and on what timescale. And I think that's very much the collaborative approach we've tried to take in Scotland, and the one that I will continue to try to do my best to lead us through. And all of that is with the firm objective in mind of getting back to as much normality for our lives and for the economy as we can, as quickly as we can, but continuing to keep this virus under control. Because if we don't do that bit, the game's a bogey on everything else. So we absolutely have to keep our focus on that. And that's in the interest of the economy, just as it's in the interest of the health of all of us. Chief Constable.
Thank you. I mean, I think the Scottish Police Federation would agree with me, and I know, having spoken with them, that the reason for all the legislation that's been introduced during the pandemic are for public health grounds. What's been needed as the health advice and the health experience has developed have been a series of emergency powers that inevitably, because they're emergency powers, are introduced in relatively short term. I actually think we're on to about the 14th or 15th iteration of powers that police would have to interpret. So that is a challenge. I recognise that for the service. I think the Scottish Government recognises that. But the reason that they're being introduced is for that public health imperative, to try to prevent the virus spreading. And what's been clear is that indoor house parties is a high likelihood of transmission, and therefore the introduction of the new offence, the introduction of a power of entry under certain conditions, are clearly necessary for that public health imperative. But we will continue to work with the Scottish Police Federation. We'll continue to work with all our officers and staff and all our partners to make sure that we do everything we can in policing to help and support the public health imperative. And finally, right from the outset, dating back to late March of this year, and as I said in my introductory remarks, the approach of policing in Scotland won't change. Enforcement will be the final sanction, the last resort. We will look to encourage people to do the right thing. We will look to ensure that they can leave a party, that they can go home if that arises, because that's how we police in this country. We work with the communities that we know, and enforcement will be a last resort if required. But I think the officers and staff of Police Scotland have done a great job so far, and will continue to do that to support the critical public health imperative that we all face.
Many thanks. Colin White from STV.
Minister, it's a question for the National Clinical Director. Professor Leitch, you'll have seen the findings of the study, the major world study on COVID-19 and its effect on children and teenagers. What does this mean for Scotland? Does it reassure parents? Does it still mean that vulnerable groups are still at risk? And is there any, or likely to be any, change in policy as a result of this study?
Thank you. It's the biggest single study of COVID that we've had so far, and it looks at age groups and demographics and then outcomes. So for those of you who haven't read the British Medical Journal this morning, it's about hospitalisation, how sick the people get, and then unfortunately what group of people die. I think there's considerable reassurance to be taken from it, particularly for the younger age group. So it says that real illness in the very young is infinitesimally, what's the word? Whatever it is, very small. And particularly in under 15s, there are almost nobody dying at all. And the very, very few who have had very severe pre-existing conditions. The other thing it tells us is that the risk factors are the ones we've been talking about now for 6 weeks or longer. They are about obesity, age, respiratory disease, and heart disease. And those are recognised now around the world. So I think your principal point about reassurance for parents is true. I wouldn't want to go too far and tell parents not to be concerned about their own health and the health of their children. Of course not. And we want them to look after them and their loved ones. But they can be reassured that children, if they get this disease at all, will have a very mild course.
Thanks. Claire McNeill from ITV Border.
Minister, you said yesterday that it was too early to say whether a COVID outbreak in Hawick was under control. You said from the information that you'd received, you were hopeful there would be no more further spread. But as you mentioned earlier, there have been 4 more positive cases within the town, bringing the total number up to 11. Are you now concerned that this outbreak is not under control and is not being contained? And secondly, how many cases or what level of prevalence will it take for the government to start considering a sort of local lockdown in the town, as we've seen in other parts of the country?
want to say something here as well, but can I say I'm not, just as yesterday I said it's too early to say it's under control, equally today I wouldn't say I'm particularly concerned that it's not under control. The nature and the life cycle of this virus just means that it is a period of time before we can say with certainty what an outbreak is going to look like and how it's going to develop. But there's nothing in the figures today that should in any definitive way be taken as an indication that that outbreak is not under control. We've seen I know Hawick is a smaller place, but I've been talking about other outbreaks over the last couple of weeks where we've got very large numbers of cases, in the Aberdeen cluster, into the hundreds, but we still managed to bring that under control. In Cooper Angus, almost 200 cases associated with that now, but still no evidence of wider community transmission. Often what you'll find is that when there is a virus there, then it will infect close contacts of the people who have tested positive. But what Test and Protect is trying to do is stop it spreading more widely than that. And there's nothing yet that I've seen that suggests that we should be concerned at this stage that that will not be an effective process here. And obviously the additional testing facilities in Hawick will ensure that the local IMT have the ability to test anybody that they think is necessary to test in order to aid that work that they are seeking to do. On local lockdowns, look, we look at a variety of different things. So it's not a straightforward threshold of numbers of cases. Obviously, the size of a place, the demographics of a place, the sort of profile economically, where a outbreak starts, but also that crucial consideration is, regardless of the total number of cases, is this one that we know is confined to a particular set of people or workplace or particular part of an area, or do we think there is wider community transmission? And it's that wider community transmission that would set some alarm bells ringing. Jason.
You've covered it, First Minister, in the main. The crucial element here is not numbers. The crucial thing is unconnected cases. And that's true in a city the size of Aberdeen, or a town the size of Hawick, or a factory the size of the one in Cooper Angus. That's what the incident management teams look for. There are two things that stop an outbreak getting out of hand. One is the health protection team's advice. So if they tell you to do something, do it. The other thing is human behaviour, and we can't all account for that. So in Hawick, follow the guidance, but equally follow the guidance in Aberdeen and Cooper Angus. So human behaviour is how we will stop small outbreaks becoming larger.
Thanks. Alan Zazinski from Global.
Thank you very much, First Minister. You mentioned the walk-in testing centres in student areas. On Monday, some students will be returning to university halls. And given the surge in demand for testing we've seen since schools reopened, are there any plans to have test centres on uni campuses themselves, as well as the walk-in centres? And just for the Chief Constable as well, if I may, are you worried that officers might have to potentially respond to and break up a lot more indoor gatherings as students return to uni halls and flats?
I'll hand over to Chief in a second. Just briefly from me, we will continue to look at the location of testing facilities. We use mobile testing units, as I've just been outlining here in relation to Hawick, to give ourselves additional capacity in a particular area quickly if there is an outbreak or a concern, and they will continue to be, I guess, our most important tactical resource in testing. The walk-in centres are more permanent, although the locations could change over time. Student populations are an early priority in terms of deciding these locations, but there'll be other considerations we take account of as well. We'll set out updated guidance for higher education and further education next week. Obviously, the decisions around testing there will be driven by clinical considerations. One thing to perhaps take the opportunity to stress here today is that international students, if they are coming from any of the countries that are on our quarantine list, there is an obligation to quarantine for 14 days, which we think at the moment is a more effective way of stopping importation of the virus from high-risk countries than testing, because you can test somebody one day, they're negative, and the next day they might be positive. So if you're an international student arriving from one of these countries, you should be quarantining, and of course universities and colleges have a role to play in making sure that that message gets across and that people comply with that guidance. In fact, the law in that respect, not guidance.
Thanks for the question, Alan. We have very good local relationships with all universities and colleges across Scotland, dedicated liaison officers. So whenever there is a return to the new term, particularly to the new academic year, we have a series of measures that we'd introduced in any event around about preventative measures in terms of online safety, personal safety. So we will be engaging with universities and colleges, and we will be building in the need to take steps to minimise transmission, to make sure that students enjoy coming to university, but do so in a safe manner. So I'm hoping that that early engagement will actually help the preventative approach that we would take with universities and colleges, but if required, naturally we would be in a position to attend, where again we would start by encouraging compliance, with enforcement being our final resort.
Lindsay Hannah from Bauer.
Thanks, First Minister. Just on the £15 million funding that you mentioned there for cultural venues, how far do you think that can go, given that the furlough scheme is coming to an end and that several venues have spoken out about being on the brink of collapse? And just a question for the Chief Constable as well. It will, of course, be impossible for the police to monitor house parties in full. So would you encourage people to contact the police if they're concerned that their neighbours are having house parties?
On the culture funding, I mean, it stands to reason I would like to be in a position where we could allocate more money to these funds, but we have a finite pot of money that we can do. We're trying to make that go as far as possible, and we're trying to include as many, in relation to this particular fund, as many venues as possible. Obviously, I can't say right now how many venues will get funding allocated, because that will depend on applications, it will depend on the scale and size of the venues that apply. But I do think this is a positive step forward for some of these venues that are in, for reasons we all know and understand, in a very precarious situation. Comedy venues have been mentioned recently. I know nightclubs are and I'm pleased that we've been able to ensure that nightclubs are included in this fund. So we will always look to see what more we can do, but I've got to also be honest with people about the constraints that we have in terms of the finite amount of money that we can bring to bear. But as I hope today indicates, we're always looking for how we can do more and go further.
Thanks for the question. I mean, our experience thus far of that the people of Scotland, the communities of Scotland, have been doing the right thing by their neighbours and respecting the fact that large gatherings should not be taking place. There's obviously now a new statutory offence has been created with powers attached to that. And again, I would reiterate the purpose behind the new offence. And the purpose behind it is to prevent the spread of the virus and to try to make sure that the country can recover as quickly as possible. So if there is a concern from a neighbour that you think somebody in your community is quite flagrantly not complying and not doing the right thing, we'll contact the police. We'll deal with it in a proportionate and a reasonable manner. If somebody is hosting an event that shouldn't be happening, our first step will initially be to explain that they're doing wrong and to encourage everybody to return from where they were. But if you have a concern, we as a police service are here 24 hours a day, 7 days a week, and therefore I would always ask, if you have concern, if you need advice, contact us.
One of the things, just one final point on enforcement. One of the things that I think has been quite obvious during the course of this is that at the stages where we have taken a decision to turn guidance into law and have enforcement powers attached to it, it actually has, from what I can tell, had an impact itself on people's behaviour. And we found that people who might, not necessarily deliberately have not been complying with the guidance, they take notice and they do comply once they realise that is a legal obligation. And I remember just not that long ago when face coverings became mandatory in shops, people were asking questions about how will this be enforced? Won't it be really difficult? Will people end up having to kind of shop their fellow their fellow shoppers for not wearing face coverings? What we found almost overnight is that people complied with the law as it was then. So, this is all just about trying to have a basket of measures and interventions that allow us to collectively do the things that need to be done to keep this virus under control. But I think the police, this is a comment based on the experience of the last 6 months. I've got every confidence the police will use these powers sensitively, proportionately, in the way that they have the other powers they've had. But I also have a fair amount of confidence based on experience that the very fact of passing this into law will actually have an effect on people's behaviour, which hopefully will mean that the need for the police to enforce it will be even less than it would otherwise be. Neil Pooran from PA.
Thanks, First Minister. If I could just return to something you said earlier on the return to offices, on the discussions about a phased return with the Chambers of Commerce, if any sort of early strategies for returning to offices have emerged from that. And you also said that you wouldn't countenance any workers being intimidated to return to the office if they don't want to. Is there anything the Scottish Government can do to ban that or stop that from taking place?
On the first part of your question, I know that the Economy Secretary's had very recent and initial discussions with the Chambers of Commerce, and that was about an agreement to do similar to the work we did with the construction sector at an earlier stage, to look at the kind of phased approach that might be adopted there, with the very clear context of having to be satisfied that the virus will continue to be under control, and we'll set out output from that work as soon as we can. On the second part, I would continue to appeal to employers to do the right and responsible thing. I know life is really tough for business and employers right now, and the vast majority have been excellent in working with us for the same objective, which is to keep this virus under control and stop it in its tracks. I would encourage employers to continue with that and to keep within the letter and indeed the spirit of the guidance that we are producing right now, because it is all about trying to make sure that we provide the most sustainable foundation for a long-term economic recovery, and we don't have to go backwards. My comment, and I sort of try to take care with my language here, my comment was more about what I've read in the media about a campaign, a UK government campaign, which is pointing out that if you're still working from home rather than being in the office, you'll be putting yourself at greater risk of redundancy. I don't think it's for other governments to decide their approach. That's not the approach I'm going to have the Scottish Government take here. We need to have a spirit to this where we're all trying to do the right things for the right reasons. And if our guidance at the moment is still as it is, work from home if that is possible, then we're doing that for a reason, and workers in that position should not feel that is somehow making their job less secure. There are clearly concerns across lots of businesses just now about security of employment, and that's a big factor that we're dealing with. But if you're following guidance about working from home, that in and of itself should not be making your job less secure than it would otherwise be. And I don't want, in Scotland, campaigns that focus on that, because I think that is putting pressure on individual workers that is not fair, because they are trying to follow the guidance, as we are all trying to do, for the right reasons. Conor Matchett from the Scotsman.
Thank you, First Minister. A few questions for the Chief Constable, if that's okay. I think it was earlier this week, the Justice Secretary was unable to answer a few questions around the enforcement of regulations to do with quarantine. So I was wondering if you could help. Can you tell us how many travellers, to your knowledge, have broken the quarantine restrictions? And can you tell us how many people have been interviewed by Police Scotland for potential breaches of the quarantine restrictions?
Thanks, Conor. I can tell you how many referrals we've had from either the Home Office or Public Health Scotland. I think, as you probably know, policing is very much the backstop in regard to the quarantine regulations and requirements. And in terms of the referrals, we've had around 200. The way we deal with them, that we try to do some follow-up initially through our contact command and control centres in terms of telephone contact. If that's not possible, thereafter we will deploy officers. And over a quarter of the referrals that we've had, we have had officers physically attend and speak to people. And if need be, we'll do follow-up visits in that regard as well. I do think it's important when you think of the discussed earlier this week, again, you may or may not have seen that we have had around 65,000 different interactions with members of the public across this whole coronavirus period. And of that, we've only taken formal enforcement action about 5% of the time. So roughly 3,500 fixed penalty notices coming out of that. So when you look at the referrals we've had regarding quarantine, they are a very, very small amount. We are there as the backstop to encourage and make sure people do the right thing when there is absolute blatant flouting of the law. But our approach to quarantine will be the same as I said a number of times, right throughout this period. We'll seek to encourage people to do the right thing. And the key responsibility are for individuals. The key responsibility is for individuals to do the right thing, not because of a potential criminal justice sanction, although as the First Minister said, what we know from the behavioural psychologists is that does focus the mind. But the key reason for doing it is to stop the virus spreading and to take that personal responsibility. So we have had a number of referrals and we have been following them up and we'll continue to do that as long as this period remains.
Maybe helpful if I just give a bit, because obviously as the Chief said there, the policing response to this is the last resort bit, so it might help if I just give some up-to-date statistics for the Public Health Scotland part of this in the context of how that works. And the first bit here I'm not sure is fully understood. Public Health Scotland contact by email initially 100% of those who come into the country with a requirement to quarantine. They then follow up a random sample through telephone calls to see if the people need help or support or information or advice. And the targets that they set initially were that they would make contact with 20% of travellers on that random basis, up to a maximum of 450 a week. But data for the week up to the 23rd of August, they actually contacted in that random way double that. They contacted 959 travellers coming into the country, and the percentage of successful contacts during that week increased to 84%. It had been much lower than that in the previous week. So that's the sort of initial approach that Public Health Scotland takes, and those are the kind of numbers that we're dealing with. Now, again, final point, just to give that a bit of context, and not because it's a competition, but to give it a context, is that, as I said, almost 1,000 travellers were contacted in that random way by Public Health Scotland in the most recent week. Public Health England samples about 1,000 eligible arrivals per day into all airports in England and Northern Ireland. So, obviously proportionately there, we are seeking to make sure that we've got a robustness into what we are doing here. And then if there is concern that Public Health Scotland has, that's when they would refer on to the police, and the police would take the follow-up action that the Chief Constable has outlined. Tom Peterkin from P&J.
Good afternoon, First Minister. There are reports that 2 COVID patients have been hospitalised at 9 wells linked to the Two Sisters outbreak, and one's gone into intensive care. We also have Scottish Government today looking at whether the risk of infection exceeds expectations, and that's still high in Perth and Kinross compared to elsewhere in the country. Can you say that the outbreak associated with the Two Sisters is under control, and what is the prospect of easing the restrictions on the workers?
Jason will want to say more in a second, probably, but on your question about hospital ICU admissions, I report the total number of hospital ICU admissions every day. I'm not going to talk about individual cases and individual outbreaks, because I would clearly then be risking breaching patient confidentiality. In terms of the exceedance in that local authority area, I would be surprised if it wasn't showing that right now, given the scale of this outbreak. And you will very often see these outbreaks feeding into those kind of numbers and making it look like a particular local authority area has a higher level overall. But as in this case, it comes from a particular outbreak. And as I said earlier on, and I can only give you the information that we have as of now. As of now, we do not think there is wider community transmission from this outbreak, and that is down to, firstly, the really good work of the local IMT and the Test and Protect teams, but also what must be very high compliance of the workforce and their household contacts in self-isolating. Obviously, the IMT, if they think any further measures are required, particularly as we go into next week and the household isolation advice ends, if they think further measures are required there, they will give advice to that effect.
We do need to be careful about patient confidentiality and individual cases, because people can get very sick from this virus. But we have had admissions in NHS Grampian and admissions in NHS Tayside, where our outbreaks have been. This outbreak in NHS Tayside worried us, but it's been astonishing to keep it as controlled as it has been. The incident management team, the contact tracing team, and the behaviour of the workers has been crucial in that control. That doesn't mean that if you get hundreds of people with the virus, some won't get sick. That's what happened in March. It's what's going to happen in August and September too, which is why we need everybody to follow the guidance. The Grampian example of now over 400 people in the last month, we would expect some hospital admissions from that group, and we would expect a very small number of people to get very sick from that group. And that's why we shouldn't take this for granted. Just because you're young, just because you want to go to indoor hospitality, you're not exempt to the illness, and you're certainly not exempt to passing it on to those more vulnerable than you.
Chris Musson from The Sun.
Hi, First Minister. This week's Scottish Government modelling the epidemic bulletin said up to 385 people a day could have been infected with COVID in the week to August the 21st. Now, this is based, as you know, on this new way of modelling and is far higher than estimates just a couple of weeks ago. But we're not seeing deaths rise again, nor does the modelling expect that. So can I ask, do you and perhaps Professor Leitch think the virus is getting less lethal, as some scientists have suggested, or have we been undercounting all along, or perhaps both, or something else?
I'll let Jason give a clinical perspective, because clearly I'm not qualified to do that. I will speak. Nothing I have been advised gives me confidence to stand here and say the virus is getting less lethal. I would love to, at some point, be in the position where I can stand there and say that, but there is nothing that I've been told that gives me the assurance of being able to say that. In terms of the modelling versus the actual, obviously at an earlier stage in this pandemic, we were heavily relying on modelled information. We've now got lots more actual information to base our judgments and our decisions on. There will always be, and it's why we stand up here and encourage everybody with symptoms to come forward and get tested. Of course, there may be people who are not doing that, so there may be more people out there with the infection than show up in our actual figures because they're not coming forward for testing, which is why we need to keep banging that drum. And there's also, we know and think this is, while still not the main driver of infection, perhaps a more significant one than we thought at an earlier stage in the pandemic, there will be people who are asymptomatic with the virus, who don't have symptoms, so are not coming forward for testing. So our actual figures, we are always worried they may be a bit of an underestimate, which is why we need to keep encouraging people to come forward. And in terms of my final point before handing over to the expert is, in terms of cases translating into hospital and ICU, I think we've got to be cautious about that, because it may be just because of the life cycle of the virus. We are not yet seeing that from a bit of an upsurge in prevalence, and we could be standing here 2 or 3 weeks from now looking at a different picture. And I just think we've got to be cautious about that. I've also read stuff in recent times that talk about perhaps people are getting a lower viral load when they get it because they might be wearing a face covering. And younger people, of course, we know are less likely to get seriously ill. But of course, that may also feed into a longer lag effect, because if a younger person is getting it, they might not be becoming seriously ill. But if they are 2 weeks later leading to the infection of a grandparent, then a couple of weeks later, they might be getting seriously ill. So I think we've got to be quite cautious about reading too much into some of these figures right at this point.
So I hope with all my heart that this virus gets less virulent, but the mainstream science says no, it hasn't. That might happen, and scientists all over the world are checking every mutation to see which one survives, because the viral mutations are different, and they do make tiny differences. And it may be we end up with a very infectious one that isn't as virulent, and that would be really good for the healthcare of the world. The other challenge around Europe in particular is that the post-lockdown infections appear to be in a younger demographic. So you would expect a lag to people who are sick, and you would expect less hospital admissions and less ICU admissions and less death because of that younger demographic. And Scotland, I think, is showing that same thing. As you come out of lockdown, it's elderly people who are still at home, who are a little bit more reluctant to go back into society. And that's probably no bad thing to do that gradually rather than them be scared or get infected. And that's why we've reached almost the limit of what we can safely open. You've heard us say that before. And why we took the decision to open schools and not to open some other things, because of that demographic shift in young people having a fairly mild course of disease. But the fundamental answer to your question is, I'm afraid the virus is just the same virus we had in March.
Tom Martin from the Daily Express.
Hi, thank you, First Minister. Could I just return to the earlier questions about the concerns raised by the Police Federation? Obviously, the Chief Constable addressed them, but are you, from a government perspective, are you satisfied that the new legislation is sufficiently watertight, there aren't any loopholes? And if you could just address one point that the SPF made, they suggested there'd been a lack of consultation with them around this. I just would be grateful if you could respond.
I think, as the Chief indicated earlier on, we are passing at the moment legislation that is by its definition emergency legislation. We, in our figures from Test and Protect and some other evidence we're looking at over the past few weeks, have seen a significant risk of transmission in indoor settings, and house parties are one of the risky activities. So we decided to act quickly to try to give ourselves more of an ability to mitigate against that. So by the very nature of what we're doing right now, we're acting quickly, and there's not the same time for the kind of consultation that you would have in normal times. But we do have very regular, let the Chief speak for himself, regular discussions with the police, with the Chief Constable himself about these issues. We will always look at experience of that the police are having in using powers, and if we have to tweak them or change them in any way, we'll be open to that. But you know, I think every one of these key changes we've made, we've had questions at these briefings which are perfectly legitimate, saying, oh, this will be unenforceable, and partly because the public actually responded in a way to reduce the need for enforcement. These changes have tended to have the desired effect. So, you know, yes, we continue to look carefully, we continue to try to respond to any practical issues that are being encountered, but I would echo a point the Chief Constable made earlier on. Fundamentally, you know, if we all do the right things here and remember that the advice we're giving people is for the right reasons, then these issues of enforcement will not arise very often. And I think that's the key message I want to get across is, please don't gather in indoor parties of, well, you shouldn't be gathering indoors with more than 8 people from 3 households, but what we're saying here is the police will have powers if it's 15 or more, obviously from more than one household, because there are some households in Scotland which themselves will have that number of people, but more than 15 from more than one household really risks transmitting this through lots of different people, and that's where, if necessary, these powers can be used if the police think it is required and appropriate.
Thanks, First Minister. Thanks, Todd. Just a brief couple of comments just to add to the observations. I mean, literally, the work that goes on between officials in Scottish Government, between ourselves and the Police Service of Scotland, between the Crown Office and others, is constant. When the health advice comes to bear that this transmission from large gatherings remained a significant threat, and then there was a legislative intent to introduce a new offence. We then worked very, very closely in a very, very compressed time frame, hours, days, to make sure that the law is drafted in a way that we think is practical and pragmatic. We have structures in place internally, as you might imagine, but Scottish Police Federation are integral to their advice, their challenge, their interventions have been central to the ability of policing to have responded, in my view, as well as it's done. So one example in the most recent iteration of the regulations was the power of entry, a conditional power of entry. And after a bit of discussion, there was quite strong feedback from us in policing, representing the views of everyone who's charged operationally to take forward the COVID response, was that actually creating an offence, but actually not having the ultimate ability to go in when required, and again, ultimately as a last resort, would actually be a major blockage. So that was introduced. The government listened to our feedback. It was made sure it was drafted in a way that made sure it was proportionate, that it complied with human rights responsibilities, and then the regulations are quickly implemented. So it has been a challenge. Again, echoing the First Minister's comments, I said myself, I think we're on to 14th, 15th version that we as a service have had to implement, and that's been demanding for the officers and staff who are then required to go and uphold the law and work with the communities. But I return to what I've said consistently, is that enforcement will be a last resort, because actually this is not about trying to get some criminal justice sanction. This is trying to about do the right thing in terms of the public health imperative. I'm not sure what loopholes the Scottish Police Federation have identified, but again, we'll work very, very closely with them, or if need be, I'll speak to them right after this meeting. And again, if need be, the regulations can be amended and can be changed. That's what's been happening in this quite extraordinary time, where legislation has been implemented in rapid time. We've worked very, very closely with everybody involved in that, and we'll continue to do that, and we'll continue to listen to the views of the Scottish Police Federation.
Thanks, Constable. Mark McLaughlin from the Times.
Good afternoon, First Minister. Just reflecting on what you said about the expansion of testing, the walk-in test centres that you're going to have. Going back to the start of the pandemic, the problem wasn't really all the kind of frontline infrastructure, but it seemed to be the backroom support as people that were actually processing these tests. So are you confident that you've got the backroom support to match all of this expansion in the streets that you're going to be doing, and particularly for care home residents and staff who are the ones that are at risk? And can you give those people an assurance that while you're testing the low risk, worried well, you're not potentially going to let coronavirus back into the high risk environments like care homes?
It's a good question, because it goes to the heart of the planning and the different bits of capacity that have to be in sync for this system to work. And I indicated one of the challenges we're working through just now, which I might come back to later on. Can I just, though, take, I suppose, maybe mild exception to the testing, the low-level worried well? We're encouraging people with symptoms of COVID to come forward for testing, because if you have symptoms of COVID and you have COVID, I'm afraid nobody knows at the outset whether you're going to be the worried well or whether you're going to develop really serious illness. And we know, as you have raised at these briefings often, even if you yourself don't have symptoms that are very strong or even at all, you can still pass the virus on. So it's really important that we don't give the impression that the people we're encouraging to come forward for testing somehow aren't a priority. But basically, and I'm going to summarise and simplify here, there's two basic things that we need to make sure are in balance. That is the capacity we've got to actually take the swabs from people, and that's the drive-through centres, the mobile testing units, these new walk-in centres, the home testing kits, and in the case of care homes, they order the kits that are delivered through the care home portal. So there's that capacity, and then there is the capacity in laboratories to process these tests and get the results from them. And we have to make sure these two things are in sync, otherwise the system wouldn't work properly. Much of our testing, not all of it, but the significant bit of our testing is done through the UK-wide system, and that's been good because we've managed to get economies of scale out of that. But obviously demand then for that system is to some extent managed across a UK-wide basis, and that's some of the discussions we're having with the Department of Health just now, is how do we make sure if demand, for example, when English schools go back next week is really high, Scotland can still access, the capacity it needs, or vice versa if demand is high in Scotland. So there will continue, as we try to build the resilience of this massive system that has been put in place relatively quickly. There will be things we need to do to make sure we've got the resilience of it as we continue to try to further expand it. But getting those different bits of the system working in sync is obviously a fundamental part of this. There's no point taking tests from people if you can't process those tests. Vice versa, there's no point having loads of lab capacity to process the tests if you don't have the capacity to actually take the swabs from people. So it's perhaps more complicated than sometimes you would get the impression of just by reading some of the commentary around this. I don't know if you want to add anything, Jason.
I don't. I think you've covered it.
Okay, thanks. Helen McArdle from the Herald. Oh, sorry, I'm being told Helen is not joining us today. Simon Johnson from the Telegraph.
Good afternoon, First Minister. I just wanted to return to the issue of house parties. You've previously stated concern about young people feeling invulnerable, invincible in terms of this virus. What would you say to young people who maybe are thinking of having a house party this weekend? They see the BMJ survey and coverage of it this morning that there's been no deaths among youngsters who didn't have an underlying health condition. There's only been an exceptionally rare number of cases of serious illness, and think, well, we are invulnerable.
I guess, firstly, I understand why young people probably even more than the rest of us just want to get back to normality, and everybody, me included, understands that. What I would say in response to that, firstly, is you don't know you're not going to be one of the minority that does get seriously ill and potentially, even worse than that. But secondly, and perhaps more importantly, you get the virus at a house party. And we know from some of the clusters we've been talking about recently, it is house parties where it has started to transmit. If you get it, you might be fine. But what if you pass it to your mum or dad who's a bit older, or your granny or grandpa who's even older than that, or your pals, grandparents, and they are at much greater risk than you are of becoming unwell. So none of us exist in isolation. Actually, lots of us are existing in isolation when we're trying to deal with this virus. That's probably not the best expression for me to use. But we all depend on each other. And even if there is one part of the population that is at lower risk, they are still capable of passing it on to other people. So you have to think not just about yourselves, think about your older relatives who you could be putting at significant risk. And the last thing I would say, which I said yesterday, this is really, really not, it's certainly not about trying to point the finger at young people. You're not, there's nothing wrong with you because you want to socialise with your pals. And it's not about trying to stop you having a social life. It's just about trying to say to you how you do that without posing that greater risk to yourselves, but even greater risk to other people in your families or your network. So if you want to gather with friends this weekend in somebody's house, that's fine, but just do it within the limits that we set and taking all of the precautions that we talk about. And I know that, it's a long time since I was a teenager going to house parties, but, if I think back to that, the kind of precautions we're asking you to take, I know are a pain. They don't make for the funnest possible house party, but they're really important, and they will allow you to have some kind of normality in your social life, but still do that safely. So please just listen, and if it's not yourself you're worried about, think about other people that you could be putting at risk. I don't know if either of you want to add anything.
So I've done some messaging for our high schools in particular in the last few weeks, and we're preparing some messages for the incoming further education and higher education students. And I think that's the message, that this disease has implications for you as an individual. So that might be mild illness. It might be severe illness. It might be self-isolation of you and your family. So that might mean your parents, those you live with, will have to have 2 weeks off work. That's not a good thing to do to the family. So there are implications of the disease, and then there are implications of passing on the disease. And that's crucial. And that could have very serious implications for your loved ones. And that's the message we're trying to get over to secondary school pupils in particular, not to scare them, but just to get them to follow the guidance. And we will endeavour in the next few weeks to get that across to our student population.
Thanks. Chris Green from iNews.
Thank you. Good afternoon, First Minister. It's emerged today that the SQA spent £140,000 using private firms to help it set up the grade moderation system, obviously which was later scrapped. I just wondered, do you think that was a good use of public funds?
The SQA did the job they were asked to do. I've covered this before. The government decided, for reasons I've set out, that we should change position. And, you know, we're in a different position now. And, you know, I personally, the Deputy First Minister, have apologised for that. And that apology would include anything that the SQA had to do that if we'd taken an earlier position, a different position earlier, they wouldn't have had to do. But the SQA were seeking to deliver something that they had been asked to do. Rachel Watson from the Daily Mail.
Thank you, First Minister. I just wanted to go back to the, you mentioned a phased approach to reopening offices, and I just wondered if you could give us any more detail on what that might look like. Are you talking about certain sectors getting the go-ahead before others to return staff to offices, or are you talking about the number of staff that would be allowed into buildings at one time? And also, you've spoken against the briefings today on redundancies for those who, the fear of redundancies with offices remaining closed. But do you have a fear that the long-term closure of office buildings could result in more people losing their jobs? And what can the Scottish Government do, if anything, to prevent that or offer comfort to people?
On the first part of your question, no, I can't give more details because what I said earlier on is we are in the initial part of discussions that will, you know, now take place, and when we've done that work, we'll set out what the detail is. So I don't think it would be helpful or possible, in fact, to speculate beyond that. I have a very significant concern, as anybody in my position should have right now, about the dangers of redundancies and unemployment because of the impact of this virus. It's one of the reasons, the key reason why I don't want the job retention scheme to be withdrawn early, because that is providing right now a protection against companies moving to make workers redundant, and I think that should be extended. And the Scottish Government is working through the different support mechanisms that we have in place, our work with the UK Government, and looking for a number of different ways in which we can protect jobs in the short term, but also help the economy recover in the medium to long term with, you know, for example, our climate change ambitions to help ensure that through that we are providing opportunities for new jobs in the green sector. What I talked about in terms of redundancies was this idea, and if I picked it up wrong from the media today, then, you know, I'm sorry for that, but it seemed to me that what was being said was not that a business that can operate isn't at risk of making workers redundant. Unfortunately, we know that is the reality for many, but the notion appeared to be that two workers working for the same company, if one was working at home and one wasn't, the one working at home would be at greater risk of redundancy. And I don't think that is the message we should be putting across. Because if somebody is working from home right now, it's because, for all the reasons we stand here and talk about, regrettably, that is the public health based advice, and they should not be at any greater risk of redundancy than a colleague who is not working from home. So that's what I was taking issue with, and suggesting that it is not an approach that we want to take here or will take here in Scotland in terms of Scottish Government advertising or campaigns or narrative around this. And lastly, Terry Murden from Daily Business.
Good afternoon, First Minister. Just on the economy, I've been contacted by a number of business people this week who about Scottish enterprise. They've been telling me that probably because of the focus on delivering the business support packages, it means that they feel that it's not able to deliver its normal range of services, limited access to RSA grants, funding for workshops. Even Business Gateway is said to be seeing some of its normal avenues closed. Could you just shed some light on whether this is the case, and whether in fact there is or will be any budget changes that will affect the operations of Scottish enterprise?
It's very difficult for me to respond in detail to anecdotes without having a bit more detail. There is probably no part of the public sector right now, though, that is operating entirely normally as it was before COVID, because the impact of COVID and the need for organisations to respond to the particular implications and consequences of that has meant displacement of effort and time and in many cases funding. So, you know, that will apply to Scottish enterprises, it applies to the National Health Service and to other parts of the public sector. But if there are specific companies, I wouldn't obviously expect you to name companies here, but if there are specific examples you want to give to us later, I'd be very happy to have them looked into specifically and perhaps come back with a bit more detail on that. That concludes the questions today. Can I thank all of you for joining us? My thanks to Jason, to Rachel, our BSL interpreter today. Particular thanks to the Chief Constable for joining us today. And again, my thanks to him and his colleagues across Police Scotland for all of the very good work that has been done to help us through this difficult period. And thanks to all of you for joining us today. Obviously, we're going into the weekend. More important, perhaps, than it is during the week for everybody out and about a bit more maybe to comply with all of this public health advice, because it is there for a reason, to keep all of us as safe as possible. So let me end with the reminder around face coverings, shops, public transport, any enclosed spaces. Avoid crowded places, even if those are outdoor crowded places. Clean your hand regularly, take hand sanitizer if you're out and about. Clean hard surfaces that you might be touching. Keep 2 metres distance from people in other households, unless you're in a place where there's an exemption to 1 metre, but do that then as well, and self-isolate and book a test if you have any of the symptoms. It's not fun for anybody to have to live with these restrictions, but it is necessary so that we can keep COVID under control and continue, hopefully, a forward momentum back towards some kind of normality. So my thanks to everybody for joining us. Have as good a weekend as you possibly can, and I'll join you here again at 12:15 on Monday. Thanks very much.